Doctor, thank you for taking your valuable time to join us today. What is going on, in your opinion, to have the statistics change so dramatically in just the last 9 to 10 years, and to see our statistics here in the state of Utah besting those in not a good way of the entire nation is really troubling.
Well, Doug, appreciate you having me on, first of all. And second of all, it is a very troubling issue. If there's a couple things that we do know, which are kind of bedrock features of kind of understanding this whole problem. Since about the end of World War II, the rate of adults has been fairly steady. It goes up and down, but as far as you take a big 50-year view, it kind of stays in the same range. Not so for children and adolescents, however. That's been steadily on the increase since about 1967, the late 60s, where before that it really wasn't much of a phenomenon. It just continues to rise. Of course, that leads to the question and kind of scrambling for why is this happening. We're not entirely sure, and that's really the state of the art, and everyone's trying to figure that question out. And when you look at suicide as a phenomenon just in human beings and the thoughts of suicide, there are some kind of rules that we follow and of understanding. One rule, first of all, is that the reasons people want to kill themselves are very individual. And it requires getting in talking with people individually. There is no formula that's been come up with, that people have come up with to try to talk to the people about that or to figure that out. So in the behavioral health world, we have a rule we follow, which is, and it's been shown to work out really well. People are often afraid to talk to other people about suicide because they're afraid it'll put ideas into their head. Hey, if they weren't thinking about it before, now it'll be that I'm thinking about it now. And by the way, thank you for giving me that idea. And they go off and commit suicide. That just doesn't seem to be the case when we look at research. So when we train people in the field, for example, and to talk with people about suicide, we teach them to be very direct. Use terms such as kill yourself. Be honest about the terms, but talk. Definitely get the conversation going. So when we say, to parents, you need to have a dialogue with your children, and to make that a point of sitting down and make it a family discussion. Hey, what do you hear about other kids killing themselves? What do you think about that? And then, do you have thoughts like that? And, bring it to the surface and talk. One of the frustrating things about being in behavioral health is that we have a lot of resources available at our command to help people, but the amount of people who still need the help, who don't access our services, is still too high. It's roughly about half the people that need substance abuse and behavioral services actually get them. And so our first and foremost message is, you need to start that dialogue with your children, and you're not going to, make them more likely to kill themselves. If you talk about it, you'll actually make it less likely, which is, I think, a different phenomenon than if they're seeing it from other sources. So, for example, in movies or from their friends, where it lacks that caring concern and that somebody's interested in who I am and what I'm struggling with.
Doctor, recognizing that there are no real clear answers on why the trajectory is so high, and I appreciated you pointing out that for adults since World War II, if I got it correct, that it's been relatively steady. The real threat and where these statistics are alarmingly not only high but going up is with our children. And if that's the case, while there are no clear answers in the studies, no absolutes here, do you have any gut feelings on why? Is it the media? Everybody loves to blame the media, and sometimes we richly deserve it. But gosh, I remember back in the day, MASH, there was the song "Suicide is Painless." There have been all kinds of portrayals, but the statistics seem to be going up. Any gut feel here?
Yeah, and I'd probably take a little bit beyond gut feel and just kind of apply, again, things that we think we know in the field as we deal with kids and their families, kids are going to be different than adults in a couple fundamental ways, and this is really important for people to understand. I mean, it makes sense once I say it, but it kind of takes somebody saying it for it to make sense. First of all, your brain doesn't fully develop till you're about 25 years old, and a key part of your brain that doesn't develop until then is the front part of your brain, the frontal lobe, which is responsible for logical thought. It's responsible for helping you to logically manage your emotions. It's responsible for helping you to, delay gratification. And another thing that the kids lack is experience. And so where you and I, might look at a problem that comes along in our life and we go, okay, well, even if it takes me a couple years to work through a particularly devastating problem, like someone dies or I lose my job or something like that, and bankruptcy, we at least have experience to look back on and go, look, I've been through tough times before. I can get through this. That's one thing that helps you. The longer you live, you should develop that kind of resilience, which is something that the kids and adolescents don't have. They don't have that experience to look back on. And then they also don't have that fully developed brain to help them, think through. And so problems that are going on to them seem monumental. They seem, 10 years for a kid to work on a problem or look forward, gee, maybe I'll be better in my 20s, seems like forever. Mm-hmm. And so there's just some fundamental differences going on there. And so then also, looking at the problems that we deal with children when they come to us, psychiatry, obviously there's the diagnosis problem. So if you have a diagnosis of major depression, then that's going to increase your risk for depression just because of the way that affects your brain. But along with that, a key component of understanding and dealing with children and adolescents is the world they're living in, the stresses, the social messages they're getting, the family environment, and so on and so forth. So, we look at what's gone on in society since the late 70s, the late 60s. You can certainly see a lot of societal changes. A lot of changes in family, the divorce revolution, changed fundamentally the way we look at families, the way we work, the stress levels. They're certainly on that palette of things that people discuss is the issue of social media and how we tend to, everyone's seen the thing where you've got two people sitting in a store and they're sitting there completely not talking to each other. I was just out to dinner the other day and we had a couple was out for it looked like their weekly date, and they're both sitting there ignoring each other while they work on their social media or answer emails and texts. Yeah. And that's a real phenomenon. If you talk to people in the schools, the principals, the school teachers, that's a big issue. And so, there's one of the rules of kids, particularly, and adolescents, when they a high risk for them thinking about suicide and committing suicide is their sense of connectedness. Do they feel connected with their family, with friends, with their important relationships? When they stop feeling connected, their risk for harming themselves goes up. And so the social media part probably figures into that as well, as kind of having the act of kind of making us more isolated and disconnected. And so there's a number of things like that are on the table that are trying to make sense of it. But those are kind of the bread and butter things that we deal with on a daily basis when people come, to our offices, to talk to listeners about it, since that's what we're looking for. That's what you can look for in your own families. Turn off the TV and play games with the family. Spend more family time together. Are you booking yourself too tight? Have there been situations in the family that may have, devastated children in their worlds? The effect on a child of parents picking up is going to be at least as stressful as it will be to the adults involved. So as you're going through tough times with the family, are we paying attention to the children and talking to them about how they're doing with the transition and changes?
Doctor, this has really been most invaluable. We're going to have to look for other opportunities to chat more about this, and I really appreciate your time today. These statistics are so startling that all of us, I think, are asking ourselves, what in the world is indeed going on. And especially with our kids, I think of how you mentioned social media and so on. I just think of what a different world we live in, especially when it comes to the interpersonal relationships and face-to-face conversations versus the whatever communication we do otherwise, texting. I look how it's changed our entire political climate. I think, too, of always the ability to bully on social media, that it used to take some guts. You at least had to be able to face, the person you were bullying. Now you can do it while you're sitting in your jammies in the basement.
No, exactly. And looking at bullying, if you and I, and this is a message to the parents out there, if you or I have to deal with a bully, we have lots of options to deal with that. If it's a bully at work, well, we can always find another job. If it's a bully in the neighborhood, we can always move somewhere else. We have some physical size. We could file a lawsuit. We could get the law involved. We have lots of options to try to deal with things like that in our world. But if you take a look at a kid who's going to a school, they have really no control over which school they're going to go to or which neighborhood they're going to live in, and then you get a bully going on, there's very few options available to these children, to get themselves out of that problem. And so suicide becomes an option to escape that. There's a general understanding of suicide that people, if they're going to take their life like that, you have to filter out the people that are doing it for political reasons or, terrorism reasons and life insurance reasons. But if you get down to the group of people that are killing themselves because their lives aren't going well, they do it because that represents a way for them to escape the pain, escape the problem that they can't find another solution to. And so you look at our kids and you go, well, they do live in worlds where they don't have as many options to deal with their problems as we do. So the message to the parents and the message to the adults that are dealing with these children should be, well, then we need to take a little extra special attention to examining our children from that standpoint, going, am I being the resource to them to help them deal with their problems that I should?
Doctor, I can't thank you enough for joining us today. We'll look for other opportunities to chat, but thank you for your time today.
Excellent. Thank you. Thank you,
Dr. Todd Thatcher, with us, psychiatrist at Valley Behavioral. And boy, the statistics, when you get a doubling of statistics in 1 decade with our children when it comes to taking their lives by suicide, that is breathtakingly upsetting. Let's take a brief break. When we come back, we had just a brief time we were at a Utah Cares event up in, or Utah Gives Back, Utah Gives Back up in Ogden. We had just a brief time to talk with Amy Winder-Newton. I wanted to spend more time on that, especially in light of this new article that I saw. All of that and more here on today's Doug Wright Show at KSL News Radio.